I'm Fenella Kirkham. I'm a clinician with an interest in sickle cell disease, and I have been collaborating with a number of people on the imaging of sickle cell disease, particularly looking at the brain, for the last 10 years. And the interest here is that we know that children with sickle cell disease have stroke, and more recently we've realised that they also have silent stroke, where the mother might notice, for example, that they have some cognitive problems, maybe not doing quite as well at school, maybe slowing down a little bit, and you can often see an imaging abnormality, usually a silent infarction, in those children, and we don't really know why that happens. One of the interesting things is that the children are anemic, and actually their oxygen saturation is also low, and we know that some of the children are iron deficient, as are a number of the children in the general population, but we actually don't know whether it would be safe to give iron supplementation or not, partly because when the children are older they tend to get a lot of blood transfusions for acute crises and then to prevent recurrent stroke. And then iron tends to accumulate in the liver, in the heart, and it may accumulate in the brain. So we have the opportunity to look at children in London who are often transfused for stroke, and we know how many transfusions they have, and also to look at children in Tanzania who are very rarely transfused but are often very, very iron deficient, so that we can try to work out whether iron is accumulating in the brain in those who are transfused, and we can also try to work out whether there is low iron in the brain of those who have low iron in the blood, to see whether we should be giving iron to those children to improve brain function. I'm now going to hand over to Karen, who is the physicist on the programme, who is going to talk to you much more in detail about the technical aspects of the project.
So my name's Dr. Karen Shmueli, and I'm a lecturer in magnetic resonance imaging in the Department of Medical Physics and Biomedical Engineering. MRI susceptibility mapping is a very recent technique which takes standard MR images and uses an aspect of them which is normally thrown away. So MR images are complex, that means they have a magnitude and a phase, and susceptibility mapping takes the phase, does several different image processing steps, including unwrapping the phase images, removing unwanted background fields, calculating the magnetic susceptibility in order to produce maps of this very interesting tissue property that should tell us about how much iron is in the brain. Tissue magnetic susceptibility mapping is a recently developed MRI technique, and the reason we think it's going to be really useful to tell us about iron in the brains of young people with sickle cell disease is that the magnetic susceptibility value that we get is directly correlated with the iron content in the tissue. And so that should tell us about how much iron there is in the regions of the brain that normally store iron. So for example, there's the basal ganglia where there's plenty of iron in normal healthy patients or healthy volunteers, and in sickle cell disease we believe that when people are transfused they may actually be iron overloaded, and so the iron levels inside those regions in their brains might actually increase, whereas in normal sickle cell disease patients we believe that the iron levels might actually decrease, and so we probably see a lower magnetic susceptibility value with our susceptibility mapping techniques. So we think that susceptibility mapping is going to be a really useful tool for allowing us to tell us about the iron levels in the brains of people with sickle cell disease and the differences between those levels between healthy people and people with this disease, so that we can understand a lot more about the pathophysiology of the disease and understand the effects of iron transfusion, and also think about how we might treat these people in future, perhaps by iron supplementation at a very early age. So I'm going to introduce you to Dr. Jamie Kawadler, who is working on this project. She's a postdoc here at the Institute of Child Health, and she has been working on using advanced MRI techniques to understand what's going on inside the brains of people with sickle cell disease.
My name is Dr. Jamie Kawadler. I finished my PhD last year with Professor Kirkham, and my background is mainly diffusion imaging, although we were able to incorporate lots of different types of MRI, like perfusion imaging, conventional radiological imaging and susceptibility weighted imaging. So we have a huge amount of new patients coming in that were available to scan on our new Prisma MRI. And this data can be combined with the data that we're going to get from Tanzania, where they have huge amounts of patients who have never been treated, which is a really great way to look at the natural history of this disease. We're implementing the susceptibility mapping sequences that we developed here and applying them in Tanzania and able to bring the data back to analyze and with collaboration with the radiologists and doctors there.
Susceptibility mapping is a technique that I helped to develop, and it's currently really exploding. There are a lot of new methods, and we're one of the leading groups here at UCL in susceptibility mapping techniques. So you'd be learning the latest techniques and applying them in a really unique cohort of patients.